Hi everybody, I'm Dr. Kat from Central New Mexico Community College. We're going to focus on skeletal muscle anatomy with the help of CNMGlass. If I draw a bone, here's a bone, very often we find that muscles are attached to bone with the help of a tendon. Not always, but when they are, we refer to this kind of an attachment, here's my muscle organ, as an indirect attachment. So when there is a tendon in between the muscle and the bone, we refer to that as an indirect attachment. Now we find that a whole muscle organ is surrounded by a connective tissue layer, or you could think of it almost as a membrane, and we call that the epimysium. Now, MYS or MYO or even MY, all of these abbreviations refer to muscle. You can even see a similarity between MUS in muscle. So epimysium means on top of the muscle organ. Now we find inside of the muscle organ that the muscle cells are organized into these bundles. And we refer to these bundles of muscle cells as fascicles. So inside of this fascicle, we're going to have lots and lots, and I can only draw a few, lots and lots of muscle cells. Now, we don't easily call muscle cells. We tend to call them fibers. Yes, anatomists use the term fibers for all kinds of things. So we can call these muscle fibers or even myofibers. Again, you see the term myo. Now, surrounding my fascicle, we are again going to have a connective tissue, and that is going to be called perimysium. Perimysium. On the other hand, our muscle cells, our individual muscle cells on top of their cell membrane, are going to be covered with endomysium. Endomysium. So if I continue drawing some more fascicles like so, bear in mind that a muscle organ is very vascularized and it receives nerves that eventually bring in the axons with their little endings we will call synaptic bulbs to innervate each one of our individual muscle fibers. So therefore, bear in mind that we have in between our fascicles, we have our nerves as well as blood vessels. Okay, so we have three distinct connective tissue layers. We have the epimysium, that's a connective tissue layer that covers the whole muscle organ. Then we have the fascicles that are surrounded with their perimysium, and individual muscle cells are also covered with a delicate connective tissue, which we call the endomysium. What we'll do next then is take a look at an individual muscle cell and see what it looks like on the inside. We need to do that. We really need to understand that microscopic anatomy of a skeletal muscle cell so that we can understand how it actually contracts. So we will do that in the next video.